My name is Sherry Cagle, and this presentation will cover the fundamental principles of care coordination. Care coordination is the intentional organization of a patient care activities across multiple providers to ensure safe, efficient, and patient-centered care. It involves clear communication, shared decision making, and supporting patients through transitions while honoring their goals, cultural needs, and preferences. Evidence shows that coordinated team-based care improves patient-reported outcomes and strengthens satisfaction, quality of life, and treatment success. Nurse-led models further demonstrate that when nurses guide assessment, planning, and communication, resident and staff outcomes improve, continuity of care becomes more reliable. These principles form the foundation for effective collaboration with patients and families throughout the continuum of care. Effective collaboration with patients and families begins with clear, respectful communication that builds trust and supports shared decision making. Nursing strengthens this collaboration by using culturally responsive approaches, assessing patient preferences, and ensuring that education, especially medication and condition specific teaching, is understandable and tailored to the patient's needs. Evidence shows that interprofessional collaboration improves patient reported outcomes such as satisfaction, coping, and treatment success. Nurse-led models also demonstrate that when nurses guide assessment, communication, and care planning, residents experience better functional outcomes and more coordinated support. By promoting self-management and involving families in care decisions, nurses help patients feel informed, supported, and confident throughout the care process. Change management directly influences the patient experience by shaping how smoothly care transitions occur and how clearly information is communicated. When nurses understand planned change, process, and anticipated resistance, they can guide patients and staff through transition with greater clarity and confidence. Evidence shows that nurses play a central role in initiating and sustaining change, and that structured change experiences improve critical thinking, problem solving, and readiness to address barriers. Effective change management also strengthens the work environment, which the ANA Code of Ethics identifies as essential for protecting both nurses and patients during complex situations. By applying change strategies that reduce confusion and support communication, nurses help create a more positive, safe, and coordinated patient experience. Ethical decision making is central to care coordination because nurses must balance patient autonomy, safety, and fairness while guiding patients through complex care transitions. The ANA Code of Ethics emphasizes protected patient rights, preventing harm, and advocating for equitable access to care, especially when patients face barriers or vulnerability. Coordinated care also requires nurses to recognize how system level challenges, such as resistance to change or gaps in access, can affect patient outcomes and to act in ways that support safety and continuity. By applying ethical principles consistently, nurses help ensure that care plans remain patient-centered, culturally respectful, and aligned with the patient's values. Healthcare policy plays a major role in care coordination by shaping access, continuity, and the resources available to support safe transitions. Policies influence how nurses communicate across settings, advocate for patient needs, and address barriers that affect vulnerable groups, including those facing reentry or limited access to primary care. The ANA Code of Ethics also emphasizes that nurses must understand policy impacts to protect patient rights and promote equitable care. By applying policy knowledge in daily practice, nurses help ensure that coordinating care remains consistent, accessible, and aligned with patient needs. Nurses play a central role in care coordination by assessing patient needs, communicating across disciplines, and ensuring that care plans remain consistent during transitions. Evidence shows that nurse-led coordination improves functional outcomes, strengthens communication, and enhances continuity of care for residents in long-term settings. Nurses also advocate for patient goals, cultural needs, and access to services, which is essential for reducing gaps in care and supporting vulnerable populations. By guiding communication and monitoring progress, nurses help create a more organized, patient-centered care experience. Patient experience improves when care is coordinated in a way that reduces confusion, supports cultural needs, and keeps communication consistent across providers. Research shows that collaborative team-based care increases patient satisfaction, coping, and overall treatment success. Nurses also play a key role in guiding patients through transitions, which helps reduce stress and strengthens trust in the care process. By focusing on clear communication and emotional support, nurses help create a more positive and predictable care experience for patients and families. Safe transitions of care depend on clear communication through discharge, teaching, and identifying risks that may affect continuity. As patients move between settings, research shows that coordinated communication improves patient satisfaction, coping, and treatment success, especially during vulnerable transition periods. Nurses also play a critical role in monitoring functional needs and ensuring follow-up plans are understood, which strengthens continuity and reduces gaps in care. By guiding patients through each step of the transition, nurses help create safer and more predictable care experiences. Continuity of care helps patients stay on track with treatment plans, follow-up appointments, and long-term health goals. Nurses support this by keeping communication consistent, checking in on patient needs, and helping prevent gaps that occur when care is delivered across multiple settings. Research shows that coordinated nurse-led care improves functional outcomes and strengthens stability. For patients who may need extra support during transitions, social factors like transportation, income, and access to services also influence how well patients maintain continuity, making clear communication and follow-up even more important. By staying involved throughout the care process, nurses help patients experience smoother, more reliable care over time. Coordinated care helps patients move through the healthcare system with clear communication, safer transitions, and a better overall experience. Nurses play a major role in guiding patients, supporting follow-up, and reducing confusion that can happen when care is delivered across multiple settings. Evidence shows that team-based coordination improves satisfaction, coping, and long-term outcomes for patients and families. By staying focused on communication, continuity, and patient needs, nurses help create a more organized and supportive care experience across the continuum of care.